Hair thinning. Anyone who sees that their hair has started to come out or that there is a big volume of hair on their comb or hairbrush should see a dermatologist as soon as possible. Hair growth that is natural. About 90% of the hair grows all the time, and the time it takes for it to grow can be anywhere from 2 to 6 years, while the other 10% of the hair is in the resting phase for 2 to 3 months before falling out at the end of the period comforts. When hair falls out, new hair emerges from the hair follicles, initiating a new growth cycle. Every month, the hair on your head grows between 10 to 15 millimeters. However, as a person becomes older, the rate at which their hair grows slows. The majority of hair loss is caused by the natural growth cycle of hair. It is perfectly normal to lose 50 to 100 hairs per day. Hair loss causes and risk factors. A variety of factors might contribute to a high incidence of hair loss. New hair grows in the place of the hair that has fallen out in some cases of hair loss. Hair loss can also be successfully managed by visiting a dermatologist in other instances. In the case of the other conditions for which there is currently no treatment, extensive and ongoing studies are being undertaken, and it appears, at first glance, that optimism about the future and its consequences is possible. In any event, it is a good idea to chat to your doctor about the best and most successful hair loss treatment options for your specific condition. The following are the most common reasons of hair loss. 1. The use of hazardous chemicals. Chemically created hair care products are used by many women and men, including hair colorants, lightening agents for colors, materials for straightening hair. Various materials were used for creasing. If these products are used as directed, there is very little risk of hurting the hair. Nevertheless, if these products are used frequently, the hair can become weak and prone to breaking. It is advisable to discontinue using these products if they cause hair weakening and brittleness until the hair regenerates and recovers and the damaged hairs disappear. 2. Hereditary baldness and hair thinning. Androgenetic alopecia, cavities is the scientific name for this disorder, which is the most prevalent cause of hair loss because it is genetically transferred from the mother or father. Women who are affected by this condition usually have very light and sparse hair, but they do not go bald altogether. In the second, third, or even fourth decade of life, this phenomenon may begin to manifest. Alopecia areata is a type of alopecia that affects men and women. The etiology of alopecia areata, or partial hair loss, is unknown, however it is thought to be linked to immune system issues. Alopecia areata can affect children and adults at any age. The injury is characterized by the formation of small, circular bald spots, one the diameter of a coin or slightly larger, in people who are otherwise healthy. Although alopecia areata is a rare condition, it can cause complete hair loss on the head and body. Although hair usually grows back, treatment with a dermatologist can speed up the regenerative hair growth process. 4. Telogen effluvium, telogen effluvium. Illness, stress, psychological stress, and other causes can cause a large amount of hair to enter the so-called terminal phase, which is the resting phase in the activity of hair follicle cells as part of the natural cycle of hair development, resulting in excessive and fast hair loss. This sort of hair loss usually stops on its own after a few months. Chronic hair loss is caused by a variety of conditions, including extremely hot weather, infections, both acute and severe, as well as acute influenza, a difficult surgery or a long-term illness, thyroid problems, nutrition that is low in protein, anemia, a lack of iron in the blood. You should take some drugs. Use birth control pills to prevent pregnancy. Cancer treatment options. Tinea capitis is a type of fungus that affects the scalp. Tinea capitis is a fungal infection caused by a skin fungus, and it is characterized by the formation of crusty areas on the scalp. This condition is highly contagious and widespread among children, and it is treatable with treatment. Trichotillomania is a disease that affects the hair follicles. The patient twists, bends, pulls, and plucks his or her hair, whether it is the hair on his or her head, the hair on his or her brows, or the hair on his or her eyelashes. Hair pulling can be an emotional reaction to stress or psychological pressure in some cases, but it can also be a serious and severe mental disorder in others. Hair pulling can be an emotional reaction to stress or psychological pressure in some cases, but it can also be a serious and severe mental disorder in others. Sycotricial alopecia is a type of alopecia that affects both men and women. Sycotricial alopecia is a fairly rare condition characterized by the appearance of bald patches followed by itching and pain, as well as the production of inflammation surrounding the hair follicles, which damages them and results in scarring and hair loss rather than growth. The cause of sycotricial alopecia is unknown, however the infection can be treated by preventing it from spreading to other sections of the scalp. The cause of sycotricial alopecia is unknown, however the infection can be treated by preventing it from spreading to other sections of the scalp. Complications of hair loss. There are obviously dangers associated with any sort of surgery, but complications following hair restoration and restoration therapies are quite uncommon. When a hair restoration surgery is performed, the person receiving treatment should expect the following. 1. After the operation, there will be a restriction on everyday activities. The prospect of him resuming to his regular activities while abstaining from strenuous physical exertion or sports activities until the doctor gives him permission to do so. 2. Additional issues. The following are examples of mild side effects. Eye swelling and bruising for 2 to 3 days, which can be alleviated by applying ice packs and sleeping in a half-sitting position. The patient loses sensation in the location from which the transplanted hair was taken or in the place where it was transplanted, although this sensitivity loss normally goes away within 3 months. The cause of hair loss. The majority of hair loss sufferers will benefit from a correct diagnosis, as a dermatologist may examine the patient and diagnose the cause of hair loss and baldness, as well as determine whether the condition will resolve on its own or if the patient will require pharmacological treatment. Treatment for baldness. The extent and kind of baldness influence the sort of procedure that should be performed to restore hair. In order to achieve the best possible result, a dermatologist may propose one of the procedures listed below. The following are some of the most common hair loss treatments. 1. Hair transplant surgery. Dermatologists conduct a variety of procedures aimed at restoring hair, as well as restoring the spots where it has fallen out and giving the hair a natural appearance. Those who have apparent baldness, very thin hair, or whose hair is falling out as a result of scalp damage or burns are the people who are most eligible for such surgeries and who need it the most. Transplantation of hair. Hair transplantation works on the premise of predominant donation, which entails taking hair from a healthy area and transplanting it to a bald area via a surgical procedure. The following items are required for hair transplantation. Removing streaks from the scalp's skin. A sample is collected from the back and sides of the scalp, which are known as donor areas because they contain hair that grows for the rest of one's life. The donation area has been repaired and restored. It is a procedure that normally leaves a little scar that is hidden by the surrounding hair. Make grooves in the scalp's skin. Hair is cut from the donating region and separated into groups of implants, to be placed in the bald patches that have been prepared for this. The size of the bald spot and the kind of transplantation used determine the size of the area that can be covered by hair transplantation. The majority of the transplanted hair falls out around a month after the operation, and after 2 months, new hair begins to grow and then continues to grow at a natural rate, and after 6 months, the transplanted hair takes on a new shape. It has the appearance and feel of natural hair. 3. Reduce the size of your scalp's skin. Reducing the skin of the head is a solution for those who have a large area of baldness. This treatment is a surgical procedure in which the bald spots are narrowed, and in some cases, completely hidden, by removing a few centimeters of hair-free skin and then sewing the two ends of the pieces together. The scalp reduction surgery can be done alone or in conjunction with a hair transplant. 4. Scalp enlargement. For 3 or 4 weeks, 2 devices are implanted under the skin of the scalp. The purpose of these 2 devices is to tighten the skin that holds the hair in place in order to improve the surgical results of the scalp skin reduction surgery. The tightening device functions similarly to an elastic band, while the expansion device functions similarly to a balloon, and both minimize the amount of hairless skin on the scalp. 5. Treatment that is difficult to understand. Treatment may consist of a combination of various medical procedures performed on different and separate dates, implying that treatment may take a long time to complete, ranging from a few months to a few years. Preventing hair loss. The following are some techniques of prevention. Select the appropriate hair products. Showering with hot water is not recommended. Give yourself a scalp massage.